Good morning, good afternoon, good evening. My name is Stephen Lazer. I am the Global Healthcare and Life Sciences CTO for Dell Technologies. From a background perspective, I've been working within the healthcare arena for over 25 years at this point, primarily working on the provider side, but also working somewhat on the life sciences and payer side of the equation, and have the wonderful luxury of working on a global basis, which means I talk to healthcare in just about every corner of the world. And as a part of that, we understand that the majority of the problems are similar, the payment models are different, the challenges are very much the same, the technologies that we have the opportunity to utilize to improve healthcare and improve capabilities are very significant. Technology plays a very significant role in what healthcare means and what healthcare can do from a global perspective, and as a part of that, we can look at ways to apply technology into what is happening now in the world and what we expect to see for the future. From a technology's perspective, as we start to look at where the future is headed and where we think the future is going, we see a number of things. First of all, the world will become a data-driven world even more than it is today, and things like artificial intelligence, things like machine learning capabilities will start to play a much greater role. As we also see some of the future, we see the patient journey changing very dramatically. Imagine, if you can, a world where we start off in your home or the patient home or the constituent home, not necessarily a patient, because we want to keep them out of the healthcare system if possible. But start our journey there as the patient has an ailment. What would happen if we had the ability to conduct some virtual triage out at the patient edge and really start to collect information about that person or patient, more information than we've been collecting on a wellness perspective, but collecting even more information based upon whatever their chief complaint is. So we go ahead and set up a virtual visit for that person and actually conduct a virtual triage session in order to apply the appropriate level of support and care for that person. As a part of that, we look at how we can go ahead and deliver healthcare to that person to the greatest extent possible, where appropriate, in their existing location, whether that be at home, whether that be on the go, in a hotel room somewhere, or anywhere else on the planet. Now, that's not always necessarily the case and not always the way that we can deliver care, but we need to look at those technologies in order to help drive efficiency in healthcare. Being able to apply the greatest level of technology to support our healthcare organizations and being able to apply that to patient and the patient journey really start to change the perspective of how we can look at those patients. The challenge is that we have not fully accepted this methodology. We have not fully bought in from a healthcare perspective, because in the fee-for-service model, we get paid by seeing how those visits go. As we look at how we can drive greater efficiency there, how do we utilize those clinicians to the greatest level of their licensure? Could we apply a nursing assistant or a nurse practitioner to a level of support that is necessary for a particular patient? Now, this is not just for chronic care management patients, but as you look at that patient journey and we start that from the home, we go ahead and conduct some remote triage and be able to collect information about that person. Perhaps it's temperature, perhaps it's a visual look at conditions, perhaps we're collecting EKG information and or listening to a remote stethoscope, all of which are possible today. With all of those technologies, how do we go ahead and start to conduct a preliminary diagnosis and be able to go ahead and bring things forward as we look at ways that we can monitor and collect that information? Now, once we have that information, we've made a preliminary diagnosis, we've decided the patient actually does require a physical visit based upon the acuity of their chief complaint. It's now time to start to kick in a few other systems. First of all, locating where that person is, being able to schedule that appointment for that person at a time that is potentially convenient for them, but sending them not only communications about that, but driving directions, sending them capabilities around rideshare systems, and providing all of that as an integrated patient visit. In addition to that, because this patient is part of a wellness solution that is engaged with them on a 24/7 basis. We start to look at the other data around that person that we've been collecting, whether it be coming from an Apple Watch or whether it come from some other device that we have been collecting information from. There are many different platforms that can do this today, but very few of them are actually integrated back into the electronic medical record. We're just starting to see that come into play at this time. Now that we've got that person, directions, and an appointment, we can start to engage some more real-time capabilities and real-time tracking. We've utilized whatever capabilities we have at the edge to go ahead and provide the right diagnosis and provide the right capabilities to where that is, to direct that patient to where they would be most appropriately seen. And as we start to send that person into the healthcare system, we start tracking with them, and whether they're coming in via rideshare, whether they're coming in via GPS mapping and their own driving capabilities, either one or both work very, very well. We've already estimated their time of arrival. We've been looking at the information and preparing the teams that are going to see that person or patient as they arrive at the facility for treatment. Once that person arrives at the facility for treatment, they are given a parking location and directions to help with wayfinding inside the facility. Unfortunately, healthcare is one of those businesses that have been added on to 287,000 times in their lifetime. And because of all the additions to healthcare facilities and all the small growth pieces that are in those physical facilities, wayfinding becomes a very significant challenge. Making sure we get people to the right place at the right time and the right location. So assisting them with wayfinding, once we've assisted them with parking capabilities and or valet capabilities in order to make sure that they're headed to the right location and headed to the right treatment location at the right time. In addition to that, I think that at that time, we should also consider engaging capabilities like notifying the care team, making sure the care team has the information about where that person is going, where they're to be seen, making sure that the records around that person have been delivered and we're able to go ahead and get them into the right location at the right time in the right place. The care team has been alerted prior to their arrival and is ready and available to go ahead and work with that person in order to treat them or provide them care capabilities as we start looking and going forward. This process and this capability only works if all are engaged from across the healthcare system. As we start to treat that patient and go ahead and provide those capabilities, utilizing things like voice assistance in the treatment room, so the clinicians actually have the capability to engage and interact with the patient rather than interact with the computer on a full-time basis, and being able to go ahead and collect and document all of what is necessary in that patient record in order to go ahead and provide a suitable diagnosis, as well as being able to provide aftercare instructions, et cetera, and get all that documentation without having the clinicians spend additional time entering data either with the patient or after the patient leaves. Once we have that diagnosis, we can utilize artificial intelligence on the back end to provide some inferencing or some recommendations about possible courses of treatment as well, especially if it is a difficult case. As we look at where that is going from a long-term perspective, I don't ever expect to see the day where we will have AI-based diagnoses as a 100% answer for anything, but definitely providing some directions, some ideas, some information for the clinicians in order to help support what they're trying to do and who they're trying to treat, and hopefully improve the diagnostic capabilities of what we're doing rather than having patient return due to some other need or use case. Going from there, the next step in that patient journey is really going to be around aftercare as we work on things like discharge. From an ambulatory perspective, discharge is typically not very difficult. On the acute care side, however, discharge is an extremely difficult thing, or at least it appears that way to the patient. And as we look at how discharge is planned and how discharge is scheduled, we need to go ahead and work with those teams, making sure that they have either near real-time or real-time alerting that the patient is ready, that the physician has signed off on the records and that patient is ready to be discharged, that we have transport engaged. And, oh, by the way, we need to think about sharing aftercare capabilities and aftercare instructions, as well as follow-up and additional appointment scheduling. In order to go ahead and do that, based upon the diagnosis, based upon the aftercare instructions, all of this can be provided electronically and in many cases is. There are a number of systems that can provide this today, but there are very few systems that actually provide this today, as well as utilize things like remote patient monitoring capabilities for follow-up or for medication adherence capabilities. And as you look at where that future is going, this I see as one of the greatest ways that we can impact care and care delivery around the world. As I understand it, medication adherence is responsible for approximately 75% of readmits or readmits, and typically they're through the emergency room, which is probably the most expensive form of care that we can possibly provide. Going from there, following on the aftercare, many of the other aspects of aftercare are often missed as we look at things like medication adherence, as we look at physical therapy adherence and direction and capabilities there, as we look at technologies to go ahead and provide all of that. What would happen if you had a virtual assistant at the patient home that could help guide them through their physical therapy and document that it's actually happening? In addition to that, what would happen if we were able to document medication adherence and the 5 rights as we start to look at how we can go ahead and provide that capability in the home as we're working with that patient? It's all available through technology. We simply need to engage it. Going from there, additionally, as we look at other things on aftercare, behavioral health is one of those aspects that never gets engaged, at least doesn't appear to often get engaged unless the case is extreme. As you look at behavioral health and coaching capabilities that we have through virtual care platforms, you're going to find that integration of those is something that is sorely needed and is just starting to come into play in today's market. To go along with that, as we start to see where this future is going, the information and data that we're collecting around that patient can be utilized to provide greater wellness capabilities as we start to engage others around that person's care. As we start to think about this and really start to think about this as a wellness platform, and we start to think about engaging family and friends, we start to think about engaging capabilities around exercise and interaction functions, we start to engage capabilities around documenting what is in that person's refrigerator, quite honestly, and validating what goes in, what goes out, and correlating that back to technology readings that we can go ahead and collect on that person. It's something we've been talking about for years. It's not something that is often done and not something that is often ever really enacted. In addition to that, we have the ability to go ahead and look at where that person is moving and or going, assuming they utilize a mobile device of some type, the ability to document exercise and capabilities there, whether it be through a fitness tracker or whether it be through some other capabilities. But all of this can be brought together. And all of this can be brought together for wellness of the patient rather than treatment of the patient. And as we think about this and think about where we're going here, technology offers us so many opportunities and so many advantages. We're just barely scratching the surface. I know that every other word that you hear around healthcare today is labeled with artificial intelligence or AI or machine learning capabilities. We are just at the beginning of this journey. We have utilized AI capabilities for some information at this point in time. I think you're going to see that improve dramatically. I think you're going to see the use cases and capabilities improve dramatically. And from an AI perspective, there are so many different opportunities within healthcare, whether they be from hospital efficiency capabilities, whether they be from other capabilities, really doesn't matter. What matters is that we utilize this functionality and that capability in order to go ahead and support those patients and be able to go ahead and drive that new care capability and be able to go ahead and look at ways that we can improve outcomes, improve efficiencies, and really drive healthcare into what it can become. As we start to think about where we're going in the long term, we need to go ahead and be able to provide capabilities that are going to move and adjust what the patient needs. In addition to that, there's going to be more data collected out at the edge. And when I say the edge, this means at the point where data is generated. That data will not necessarily be of great value unless it is summarized and we go ahead and create some value out of it. But as we look at where things are going on a long-term basis, the ability to go ahead and create and summarize that data, the ability to go ahead and drive capabilities utilizing that information, the ability to conduct analytics based upon data sets that are not necessarily housed within the organization, but housed within many organizations, and simply bring back summarized results or summarized capabilities is really the holy grail of where we're going from an artificial intelligence perspective and machine learning perspective. There can be much, much more to this conversation. All we need to do is get engaged and really have that conversation. There are many technologies out there, and as we start to see the capabilities of new processing functions, see the abilities of things like 5G come into play, we're going to see more and more of this really start to play out as to where healthcare is going. With that, I think I'm going to go ahead and conclude this talk for the moment. I would like to say thank you very much for spending a few minutes with me. I truly appreciate the opportunity to speak to you all. There are so many exciting opportunities as to what we see coming forward within healthcare that I think that the future holds tremendous promise. But I think we need to wade through some of the noise and be able to go ahead and select those technologies and solutions that really will provide a new capability and provide new functionality in order to support our patients.